go. I'm following you.
Visiting Nurse Association started in 1909 to provide care to individuals in their home.
The mission of the Visiting Nurse Association is to provide the highest quality of home and community-based health and support services to individuals promoting health, dignity, independence, and self-sufficiency in the comfort of a patient's own home.
We've continued that tradition for over 100 years, providing personal care and skilled services in individuals' homes.
In our same spot.
We have nurses and physical therapists and occupational therapists, as well as aides to provide that service.
I always did all these 5Ks and that, and I was always placing for my age group.
Bill Wagner is a survivor. He's a champion and a runner at heart.
Normally did most of my 5Ks in about the 23-minute.
He fell during a training run.
I hit the ground and I said, oh shoot, I'm gonna need surgery.
Jeanette Clark survived heart surgery
They came the day after I came home from surgery.
and gained more than just a nurse.
Well, actually, she became one of my very best friends, I can say. Without them, I'm not sure where I'd be today. I think she was real concerned about me as a person and my life, and she's just as great.
The nurses at VNA are great, and Jeanette discovered a great new way to monitor her health without leaving home.
When I used the telehealth and it got the results were turned in.
VNA was one of the first home health agencies in Greater Cincinnati to implement a telehealth monitoring program.
Did you have trouble sleeping last night due to feeling short of breath?
And if
Are
it was
your
something
ankles,
that
feet,
I
legs,
couldn't
or
take care of or needed special care, then she would call my nurse, and then the nurse could come out and check me.
The telehealth monitoring system has reduced hospitalization of high-risk patients.
Wrap the cuff tightly around your arm.
Telehealth monitoring allows patients to be remotely monitored 7 days a week through the use of touch monitors like this one.
I really do give them the credit for bringing me through tough times.
Jeanette made it through her tough times, but some patients need a special kind of care.
As we saw patients continuing to progress throughout their disease process, we recognized that the area that we lacked was the ability to provide those hospice services.
Heart and Hands Hospice by the VNA is a brand new hospice that has the opportunity to provide excellent care to our patients. People misunderstand a lot of times what hospice is. People think that we come in and help people die, and that is never our goal. Our goal at Heart and Hands Hospice by the VNA is to help people live.
Bill has an especially strong will to live, and VNA Home Health was there to help.
Okay, Bill, I have a couple other...
After a bad fall and surgery, it was discovered that Bill had a bigger problem. Bill was diagnosed with a tumor that left him paralyzed.
Sure enough, MRI showed the tumor was growing. That's when VNA, visiting nurses, came into our lives.
The doctors were trying to tell Vivian, my wife, that she has to do it, tell me that I would never walk.
They sent him home and told me he had 2 to 6 weeks left to live.
Doctors said Bill would never walk again, and after being diagnosed with bacterial meningitis, Bill was told he only had 2 to 6 weeks to live.
That was in June of 14.
And I tried and tried. I am going to walk.
They worked with him, they got him up and walking.
I grabbed her arm, I stood up, and it was her holding her arm. I started walking. And it's such a joy every time I see it. They're saying that I'll never walk.
Bill, with a little faith and a little help from the VNA, defied the odds by staying alive and learning how to walk again.
And it's been a bit of a roller coaster. Visiting Nurse Association is and has been a lifeline.
The Visiting Nurse Association is a true lifeline. Whether it be personal services, hospice, or home health, the VNA serves people like Bill, Jeanette, and all of Greater Cincinnati and Northern Kentucky.